Hey guys, welcome back to the DrCliffAuD vlog. This is vlog number 27, and it just so happens to be the 4th of July today, but we're going to take a little break from our celebration to kind of fill you guys in on what happened this week in the clinic, and it actually was not a good thing. We had a patient fall inside of our clinic, and we actually had to call 911. Just to give you a little bit of background, I had a new patient come into my clinic, was the husband of an existing patient that I have. And when I was going through the health history of this individual, it turns out this individual had a history of atrial fibrillation. Basically, he has a heart condition. And when I was asking him about, if he ever felt dizzy or had vertigo or had any risk of falling, he had mentioned that he had never fallen before, but sometimes when he gets up from sitting down for a long period of time, sometimes he can be a little lightheaded and he has to hold on to something. And so, that was, relatively early in the appointment. But like I always do, I took him in the back and took him into the sound booth, warned him about the little lip that there is going up the ramp into the sound booth, because the one thing that I am deathly afraid of is people falling, going into and coming out of the booth because of the little lip that's there. Got all the way through testing, no issues, went back in, took the inserts out of his ears, took the bone conduction device off of his head, and he stood up. We, chat for just a second. I explained to him that we're going to head back into my room and go over the results of the hearing test, and he asked if he could use the restroom. I said absolutely. I walked out into the hallway and turned around and told him that it's just kind of down the hall and to the right. And so he headed off that direction. I headed in the opposite direction and went into my room to get things set up. And then I heard this thump and someone kind of moan, and I was like, oh, that's strange. So I immediately, of course, stood up, opened up my office door, and then on the floor was this gentleman. And I knew that it was the person that you were doing your hearing test on, but so immediately I just kind of got down on my hands and knees. He was awake and alert, kind of like did a really quick head to toe look at to make sure there was like no large amounts of blood spewing anywhere. And that was one thing. He was on blood thinners. That's another thing that I uncovered initially. And I remember seeing that there were some scrapes on his knees, but for some reason they were not bleeding very much. And I should just fill you in on this. Ashley, who you've met in a couple vlogs prior to this, of course, is my wife. And she's also a registered nurse. And she's actually had experience working in the emergency room as well as in urgent care. And so in terms of, having someone on staff who is really good in those situations, I would say that she is probably the highest level of expertise that you could ever possibly want inside of a clinic from a medical standpoint and an emergency medical standpoint. And so basically, I think wasn't it Courtney who came up and told me that he had fallen?
Yes, yeah. So she came, I think she must have heard me speaking to the patient, and she immediately came back, and I just prompted her to call 911 because I wasn't really quite sure the, full extent of this gentleman's history, but I knew that he was probably over the age of 65. And, my initial concern was, one, I want to make sure that he's awake and he's breathing, and all of that was good thus far. But I just, at our clinic, we don't have any of the supplies that one would need if anything were to happen any more gravely than what was at the current situation. So,
which makes me question if we need to step up our emergency preparedness if stuff like that were to happen, because this is actually the second time that this has happened, I think, within a year. And, which kind of leads me to this next part, which is individuals who have a hearing loss if you even have a mild hearing loss, you are 3 times more likely to experience a fall. And that's kind of a scary number. And this is from data out of Johns Hopkins, Dr. Lin, and I believe it was in 2012, they identified that the risk actually increases with an additional 10 decibels of hearing loss on average. It increases the risk by 1.4, which is like a massive increase in risk of falling. And this is when they're taking into account, age and gender and all of this stuff, and they're kind of separating out that as being the root cause of it. Because I think a lot of people would just assume like, oh, well, individuals get older, they get hearing loss, and then as you get older, you also tend to lose balance. Well, they controlled for those factors, and hearing loss in and of itself is another leading factor of whether or not someone would experience a lot of falls.
Right.
And that's dangerous when you start getting into the clinic.
Yeah, I mean, I think like there's, I think in my own personal life, I take for granted all of my senses that I just innately have the ability to use. And I think once you start to have those compromised, you don't really realize how important they are to, your everyday activity, everyday events that you take part in. And equilibrium is a huge thing. And just working in hospitals and emergency rooms, falls is a huge reason, that causes a lot of scary things for patients. It can cause lots of traumas.
Yeah, exactly.
It can cause
leads
death.
to other things. And the older that you are and fall, the quicker that it actually leads to death. I mean, when someone has a broken hip, I don't know what the statistics are, I can't remember them, but I heard some startling statistic, something that said like within X amount of months after a fall beyond the age of, 80 or whatever that number was, that mortality, kind of sets in.
Yeah, it's pretty high.
Which is kind of scary. But, I know that there is at least one hearing aid manufacturer right now that has developed technology inside of their hearing aids that can identify when someone has fallen and actually alert a family member or someone who's a caregiver for that individual. And it kind of reminds me, Courtney, our front office and staff person, came up and she's like, Cliff, it's a good thing that he didn't fall in the restroom with the door locked. We do have the way to emergency open the door, but still, like, we wouldn't have known. And if he would have hit his head, and passed out, like, it would have just been a really, really bad situation. And so, it can help. I'm trying to think of other ways to, identify if someone has fallen. I'm thinking from a clinic perspective, there's not a whole lot that we can do. We can put some kind of an emergency system inside of a restroom if someone has fallen. But other than that, it's really hard to think of a way to kind of control that situation.
Right. And, at hospitals, they have like a button or a pull string that if you're feeling unsafe, that you can pull that and it alerts an alarm, like a blinking alarm on the door. And then of course we have keys that we can get in there. But other than, walking your patient to the restroom and just knowing that they're in there and, just having an understanding of like potentially how long they've been in there and kind of checking up on them, those are just things that we could do if we didn't have an alarm system. I suppose one of the things that we could potentially start doing is if we have patients that have history of like dizziness and stuff, just make sure that we stand them up, ask them if they're dizzy or if they're feeling unsteady. And if that's the case, we probably should just sit them back down and they can use the washroom when that passes. This particular, individual had those episodes in the past, and there's no way of knowing when those are going to happen. He could have gone to the washroom and had no dizziness or lightheadedness until he stood up from the toilet, if that's in fact what he did. So it's like, you can run these scenarios in your head to think about what all you could have done to prevent it or how we can, be more prepared for that. One of the things that I think about is having like a defibrillator there. If a lot of places out in the public theaters and restaurants usually have those kits around, and that's probably something that we could consider.
And I also think from a staff protective standpoint, we should probably have, where if you have to give mouth-to-mouth resuscitation, there's more safe ways to do that rather than just, especially right now with COVID going on, it gets even a little more scary.
Yeah, and part of me thinks like, oh, well, we could, have our staff trained in CPR. Maybe we could even call the local fire department and have them come and just do some like lunch trainings on, first aid and those types of things, just so that we're a little bit more prepared. I mean, I'm prepared for that kind of stuff.
If you happen to not be in the office one day, I mean, like the protocol right now is like if anything medically happens, we just like, where's Ashley? Because she's very specifically trained for that. It's been a long time since I've been in the Marine Corps. Like we're more like severe trauma trained. If someone gets shot and things like that. Of course, Charlie wants to make some noise again. Come here, puppy. Come here. Okay. So, but at the end of the day, he ended up being fine. We kind of ended the appointment at that point. Of course, we had what was that? The EMTs came, and
the paramedics came.
The paramedics,
and the fire department, and they did their normal routine stuff. They checked his blood sugar and EKG rhythm and blood pressure and all that stuff. But the highest risk or the highest thing of importance at that time was that this individual was on a blood thinner and he had fallen.
Yeah, and you don't know internally bleeding-wise, too.
You can't always see when there's internal bleeding going on, so he just wanted to get that checked out, and I would have. Well,
they went to the emergency room for 6 hours and then finally released him. We had contacted them the day after it happened, and he was fine. So thank goodness. I kind of feel like a bullet was dodged by him. I can't help but feel really responsible for that. I mean, you can always look back in hindsight and be like, oh yeah, I mean, I should have stayed there and watched him make his way to the restroom, which seems kind of odd, But like you try to think of things like how could you have prevented that in the future, and I don't think you're ever going to prevent any or every single thing like that. But then how do we change things to make sure that, if it does happen again, that we're more prepared to handle the outcome of that?
Right. I think in a hospital setting, when my patient wants to use the washroom, I walk them to the washroom. That's just what we do. And I guess technically we could institute that as well at our practice. It's just hard to say because like some patients might think, oh, he's just gonna walk me to the washroom, I guess, today, So I mean, like some people that are very potentially independent and don't rely on a lot of help might find that behavior of us walking them to the washroom a little bizarre. So I don't know. I think as long as you ask them if they stand up and are they feeling okay, you're not dizzy or lightheaded.
And I think that's probably the question, is that we need to ask them, if they have had any kind of medical history whatsoever, heart-related, whatever, to ask them, are you feeling lightheaded as soon as we stand up and we're getting ready to exit the booth?
Quite frankly, you could even ask your patient, like, I'm happy to walk you to the washroom, just to make sure that you don't get dizzy or lightheaded or, if they have that history of being, dizzy when they stand up, because I mean, unless this was the first time occurrence, which it wasn't the first time this had happened with this gentleman. He had experienced episodes of
he had mentioned that he would feel a little bit lightheaded when standing up. So but he'd never reported actually falling before.
Yeah.
But now he has to. So
and who knows? Like there's a lot of factors involved in this. Like it's really hot right now. The only thing he had to drink was coffee. So I mean, there's just a lot of factors that could have played into why he was a little lightheaded and kind of off kilter when he was walking to the washroom. So luckily and thankfully, no serious injuries.
Yeah, for sure. So, well, I mean, quite an eventful week for us. Hopefully we don't have to do a video like this ever again. But, just want to make sure that you guys are aware that, when you have a hearing loss, it does put you at more risk for falling. And you really have to take this stuff into consideration, in terms of protecting yourself. If you feel like you are, at a higher risk, you got to make sure that you let people know. And you have to have an emergency kind of like checklist in place for if you do end up falling. So, and like I said, there are actual hearing aids, which is crazy to think about, that can, if you you fall, they have motion sensors in them that can send a notification through your smart device to family members or a caregiver. So, so they can come in and check on you. And I've actually heard stories of people's lives being saved because of that technology, which is absolutely crazy. But nonetheless, that is it for this week's vlog. Make sure you check out the other vlogs on my YouTube channel, DrCliffAuD. And as always, we'll see you next week.